I want to take a minute to talk about pregnancy and Sjogren's. This is based off of some comments from this individual who wrote stating that their doctor has been trying to dissuade them from having children because it puts you and the baby at a high risk. I think some of the most helpful doctors are the ones that give you the information that you need in order to make a decision for you and your family. And so this is what I would tell you as a Sjogren's disease patient myself, who was diagnosed with Sjogren's prior to having a child. Number one, Sjogren's does put your baby at a higher risk of developing congenital heart block. And there are things that your doctors do to monitor you throughout your pregnancy to try and discover it as early as possible if it does develop. And if it does, they put treatments in place to try and mitigate it. So what does this look like? For me, I went and got an echocardiogram, which is a special type of ultrasound that listens to the baby's heart. It's best to do this between week 17 and week 20 of your pregnancy. And that is going to indicate whether your baby's heart is developing that congenital heart block or not. And typically with Sjogren's disease, with it being a high risk, your doctor will, your OBGYN will monitor you weekly for the remainder of your pregnancy after 20 weeks. And so for me, this was going in for an ultrasound once a week, and it was an external and an internal ultrasound. Just to monitor the baby, monitor the heart, and monitor myself to see how things were going. Now, going back to the congenital heart block, if they discover something in that echocardiogram, then what they're going to do is they're going to provide steroids to you as the mother that is going to be sent to the baby that is going to help boost the development of the heart to try and to mitigate the impacts of the congenital heart block. Another thing that is not talked about enough when it comes to autoimmune disease patients getting pregnant and post-pregnancy is that your autoimmune disease can go like haywire after the baby is out. And the reason why this happens is because when your body becomes pregnant, your body signals to your immune system to take a break, to like fall back, to not attack, because you don't want your immune system attacking your own baby. So your immune system kind of goes on, like it's still there, but a little bit of a vacation. Like my autoimmune disease symptoms went into remission during my pregnancy, and it was like the most beautiful time. I absolutely loved it. But after my baby was out, my autoimmune disease came like and hit me like a ton of bricks, and it was just so bad. So, and that's what happens. So your immune system after the baby is out goes, oh yeah, there's no more foreign invaders. We can get back to our job. And it does, but it goes like even worse. So that's another thing to consider depending on how bad your disease is or where you are on your autoimmune disease journey. So now you're met with all of this information, and you and your spouse need to then decide, is it worth the risks to the baby and to myself to continue forward and trying to have a baby of our own. So again, like my doctors were telling me at the time that there were definitely risks involved, but it is possible to have a healthy pregnancy. But you need to be aware of these other things that might impact your pregnancy and your own autoimmune disease. And with that information, my spouse and I decided to try for a baby. This was a decade ago. And so I ended up having a baby. I got pregnant. My pregnancy was monitored closely. My baby was healthy. I didn't have any congenital heart block. My autoimmune disease kicked my fucking ass once he was out. But I was as prepared for that as I possibly could. And so, yeah, I don't want to dissuade anyone from looking at all of the facts and all of the information to help you make an informed decision if you're thinking about having a pregnancy with an autoimmune disease.